And whenever you said the type 1 respiratory failure is a major issue that they are presenting with. So is it very severe type 1 at the outset, or it is deteriorating with time, with, or it is improving with time? What is your experience on that? The
Majority of patients are
present.
only needing small amount of oxygen. Ma- Majority are only in a mild degree of respiratory failure and needing small amount of oxygen. Sometimes they are okay on 40% oxygen or less, but then a small group of people are needing more with time, and then there is another group who are needing fairly high degree of oxygen from the outset. But that is not the majority uh, who are needing. What we are doing is we have got a triage system. So some people will need humidified oxygen up to 40%, and they are fine in the ward. And then another group will need high flow nasal oxygen, and they also get it in the ward or in the high dependency. And then if there is any sign that they have got a fair degree of tachypnea, they are being kept in a high dependency so that they can be intubated quickly. And eventually some are needing intubation fairly within first 48 hours.
So within 48 hours, you are intubating people because those people are deteriorating pretty fast.
There's a small number of people, as we said, our number are not, we are not going into 20s and 30s intubated now. We are expecting that to happen over the next 2 weeks, because that's how the disease trajectory is in our area. But there one group, what is very specific about this particular disease is there is a group of people who are going down very fast, who are okay in the ward for a while, and then in a matter of 6 to 8 hours they can go down very fast. And that's why it's important that they are kept in a place of safety where they can be monitored very closely and can be intubated quite quickly. And another important aspect of I was mentioning previously about the healthcare response, practicing intubation for these patients is very important, because intubation itself is a aerosol generating
I will come
procedure.
to that.
The-
Dr. Rahul, I will come to that. But before we proceed towards that point, I have two questions for you. One is that you mentioned HFNC, right? High flow
yeah,
nasal oxygen or cannula, what to say. Because a lot of news that been trickling is that it increases the chance of aerosolization as well as spread. So,
yeah.
how come NHS is practicing HFNO?
Uh, well, if you look at the Chinese guideline, the South Korean and Chinese literature, they have used HFNC quite a lot. That's number one. And we are seeing that some people can be salvaged by HFNC alone. If you have a patient who has got a respiratory rate of 30 to 35, is saturating 94 95% on say 70 80% HFNC with a high flow, uh, and otherwise quite comfortable. We are seeing patients who are texting away whilst being on 80% HFNC, quite comfortable, being able to eat and drink. It seems premature to ventilate them, and with the bulk of disease that's coming, already is there in some parts of UK and will be on our way fairly soon. If you tend to intubate those patients early, you will run out of ventilators. So
Okay,
what
so
is
you are
needed
saying
is use.
that it will spare, it's a sparing the ventilator strategy, right? Albeit the risk of aerosolization is still there. And but do you recommend to give them HFNC in a negative pressure isolation ward or something like that?
If there is negative pressure, fine. Otherwise, what you have got is you have got the airflows. There are airflows in the rooms. There are 10 to 15 changes of air every hour, and there is fairly good evidence that after 20 to 30 minutes, your aerosolization is quite low. And what also we are doing is, if they are in an isolation bay with four other patients or in a single room, then the nurse who is there with them, they are in full gear, they're in full they're properly gowned, and they're wearing masks which they are fit tested for. So the chance of cross infection or infecting the healthcare worker is low in that situation. So I would not advise that the patient is on HFNC and you are going in and out without any personal protective equipment. That's not the idea. You use them, you must make sure that they are in an isolation room or bay at least, cohorted with other patients, and then anybody who goes in have got protection. And